Facilities include a well-stocked library for both staff and students. Residential accommodation for students was made possible through a grant from the Dutch government. Assistance from overseas charities created a sound infrastructure and enabled Global Hospital to take healthcare to the community. A mobile hospital van staffed by a doctor and paramedic is regularly driven to remote villages where modern healthcare is completely absent. The road is long, and it is easy to get overwhelmed by the enormous task of providing adequate health care and modern amenities to these village folk. Their colourful attire belies the poverty and disease that rules the lives of these people. The pressing need to work to ensure rudimentary livelihood means that the illnesses often remain untreated. This is where the mobile team steps in. The doorstep service ensures their medical problems are addressed, and the family members are able to receive medical treatment. Even though the doctor is keen to help, communication with the villagers is often hampered, not so much by language, but by their hesitation and fear of modern medical practices. A growing number of villagers with access to modern schooling now recognize the doctor as a benefactor and mediate to assist him in convincing the sick of his curative remedies. Once the villagers feel comfortable with the medical team, they are willing to share their problems and stresses. A few are inspired to give up tobacco or betel nut and address the reality of their addiction to alcohol.
So he is addicted, and we just given a class on addiction and what it can do to you and how you can get sick. And so he comes in the van and he writes up, don't want to be addicted anymore. And he takes a vow like that. Then he writes it up, and then we give him medicine, homeopathic medicine, to help him to get over his addiction. They are very, very effective.
The result of all these endeavors is to make friends for life. Well-wishers often give the hospital toys for the village children, which are eagerly received. These woods are lovely, dark and deep, but I have promises to keep, and miles to go before I sleep, and miles to go before I sleep. The seriously sick are thankful and relieved when they get moved to the hospital, where they are certain to get life-saving medical treatment, together with the same loving care they receive in their village.
service to the needy, especially in healthcare, works wonders in bringing smiles not only on the faces of the patients but even their families and friends. That is a great service to humanity.
The Global Hospital team is keenly aware that its medical services need to be shared with more and more people. Your support and good wishes ensures that together we bring back the smiles.